Welcome to Final BDS Made Easy. In this video, we are going to discuss about the one markers from the subject of oral medicine and radiology. First question is Nikolsky sign. Nikolsky sign is a clinical dermatological sign where gentle lateral pressure on the skin or mucosa leads to the detachment of the outermost layer, resulting in a blister or erosion. It is a diagnostic indicator for conditions like pemphigus vulgaris, bullous pemphigoid, and other blistering disorders. The sign is elicited by applying gentle pressure with a finger or a blunt instrument on the skin or mucosa near a lesion. Positive Nikolsky sign indicates the presence of a compromised adhesion between epidermal cells often seen in autoimmune blistering diseases. Second question is hairy leukoplakia. It is a white corrugated lesion on the lateral border of the tongue, often associated with Epstein-Barr virus infection and commonly seen in immunocompromised patients, especially those with HIV or AIDS. Third question is Wickham's stria. They are fine white lacy or reticular lines seen on the mucosal surfaces characteristic of lichen planus. Question is capillary fragility test. It is a diagnostic test used to assess the integrity of capillary walls. A blood pressure cuff is applied to the arm and inflated to a level between the systolic and diastolic pressure for about 5 minutes. The presence of petechiae below the cuff indicates increased capillary fragility, which can be seen in conditions such as scurvy, thrombocytopenia, and certain vascular disorders. Fifth question is TENS. Transcutaneous electrical nerve stimulation. It is a non-invasive pain relief method that uses low-voltage electrical currents delivered through electrodes placed on the skin to alleviate pain in conditions like myofascial pain dysfunction syndrome. Next question is TNM staging of oral cancer. It is a classification system used to stage oral cancer based on the size of the primary tumor, the involvement of regional lymph nodes, and the presence of distant metastasis. Next question is von Recklinghausen's disease, also called neurofibromatosis type 1. It is an inherited disorder characterized by multiple neurofibromas, cafe au lait spots on the skin, and other systemic manifestations such as skeletal abnormalities and optic nerve gliomas. Next question is pyrule. It is a localized, well-defined and fluctuant swelling or abscess formation in the oral cavity, often associated with dental infections or inflammatory conditions such as periapical abscess or periodontal abscess. Question is bite wing radiography. It is a dental radiographic technique used to visualize the crowns of the upper and lower teeth in a single image, particularly useful for detecting interproximal caries, assessing the fit of dental restorations, and evaluating bone levels in the posterior regions of the mouth. Question is the penny test. It is a darkroom safe lighting test, a method used to assess the effectiveness of safe lighting in the darkroom for developing dental radiographs. It involves placing a penny on a sheet of dental film and exposing it to safe lighting for a specified time. If the image of the penny is visible on the developed film, the safe lighting is inadequate and may cause fogging of the radiographs. Question is emulsion peel. It is a processing error due to the ablation of image during processing and excessive time in wash water. Question is Clark's rule. Clark's tube shift technique, also called the slop technique. This radiographic method is used to determine the buccolingual position of an object by taking two radiographs from two different angles. The rule, same side lingual, opposite side buccal. applies. If the object moves in the same direction as the X-ray tube, it is on the lingual side. If it moves in the opposite direction, it is on the buccal side. This technique aids in localizing structures within the jaw. Next question is phlebolith. Phlebolith is a radiopaque calcification seen on dental radiographs, typically in the soft tissues of the oral cavity. Phleboliths are usually benign and represent calcified thrombi within venous structures. Replenisher. In radiology, a replenisher is a solution used to maintain the strength and effectiveness of the developer and fixer chemicals. Regularly adding replenisher helps to counteract the depletion and oxidation of these chemicals, ensuring consistent image quality and prolonging the life of the processing solutions. Next question is kVp. Peak kilovoltage is the maximum voltage applied across an X-ray tube. Higher kVp decreases film contrast and reduces patient exposure. Question is cherry blossom xylographic appearance. It is a radiographic appearance observed in xylography characterized by multiple small round or oval radiolucent areas representing dilated ductal structures resembling cherry blossoms. This appearance is typically seen in conditions like Sjögren syndrome. Next question is, what is Sjögren syndrome? It is a chronic autoimmune disorder characterized by the progressive destruction of exocrine glands, particularly the salivary and lacrimal glands, leading to symptoms of dry mouth and dry eyes. Dry mouth is also called xerostomia and dry eyes is also called keratoconjunctivitis sicca. Question is, what is phantom tooth pain? It is also known as atypical odontalgia. It is a chronic pain condition where a patient experiences tooth pain in a tooth that has been removed or in a site where no obvious dental cause can be identified. Next question is, enumerate 3 forms of chronic atrophic candidiasis, that is denture stomatitis, angular cheilitis, and median rhomboid glossitis. What is Gorlin-Goltz syndrome? It is also known as nevoid basal carcinoma syndrome. It is a genetic disorder characterized by multiple basal cell carcinomas, odontogenic keratocysts in the jaws, palmar and plantar pits, and skeletal abnormalities such as bifid ribs and spine deformities. Spine bulla and vesicle with example of one lesion. Bulla is an elevated blister-like lesion containing clear fluid that is more than 1 centimeter in diameter, example of which is bullous pemphigoid, and a vesicle is an elevated blister containing clear fluid that is under 1 centimeter in diameter, example of which is herpes simplex. Next question is, discuss the role of antioxidants. Antioxidants play a crucial role in oral health by neutralizing harmful free radicals that can damage oral tissues. They help protect against oxidative stress, which is implicated in various oral diseases and conditions including periodontal disease and oral cancer. Antioxidants also support tissue repair and maintenance, contributing to overall oral health. What is Nikolsky sign and it is presented in which lesions? It refers to the ability to induce separation of the epidermis from the underlying dermis with slight lateral pressure. It is typically seen in pemphigus vulgaris and other vesiculobullous disorders such as staphylococcal scalded skin syndrome, toxic epidermal necrolysis, characterized by intraepithelial blistering. Treatment of leukoplakia. The treatment of leukoplakia involves addressing underlying causes like tobacco cessation and chronic irritation. Medications such as retinoids, example isotretinoin, may be prescribed to reduce epithelial proliferation and promote healing. Additionally, topical therapies like corticosteroids, example triamcinolone acetonide, or vitamin A analogs, example tretinoin, can be used to manage symptoms and aid in lesion regression. Regular monitoring and in some cases surgical excision or laser therapy may be necessary for persistent or high-risk lesions. Enumerate three principal radiopaque lesions of jaw. First is osteoma, then osteoblastoma, and ossifying fibroma. What is inverse square law? The inverse square law states that the intensity of radiation is inversely proportional to the square of the distance from the radiation source. Mathematically, this law is expressed as I is equal to 1 by d square, where I is the intensity of radiation and d is the distance from the source. This principle governs how radiation exposure decreases rapidly as the distance from the source increases. The question is, what is ghost image? Ghost image, it is a blurred image which is formed when the object lies in between the center of rotation and the X-ray tube. These images have characteristics like it is on the opposite side, seen blurred, seen superiorly than the original image, and seen magnified. Write contents of developer solution. It contains phenidone hydroquinone as the developer, sodium hydroxide or potassium hydroxide as the activator, sodium sulfite as the preservative, and bromine containing compounds as restrainer. This racket pattern in radiograph is seen in which lesion? It is seen in odontogenic myxoma where septas intersect at right angles. In this appearance, lesions are composed of angular rather than rounded compartments due to straight septa. Floating teeth appearance in radiograph is seen in which lesion? It is the description given to the appearances on imaging of teeth hanging in the wind as a result of alveolar bone destruction around the root of the teeth. It is seen in squamous cell carcinoma and eosinophilic granuloma. What is focal trough? A focal trough in panoramic radiography refers to a three-dimensional curved zone where structures are in sharp focus. It is created by the positioning of the X-ray tube head and the movement of the receptor and patient during exposure. Proper alignment within this focal trough ensures optimal clarity and detail of structures, minimizing distortion and blurring in panoramic radiographs. What is TLD and describe the use of it? A thermoluminescent dosimeter is a device used in radiology to measure radiation exposure. It contains crystalline materials that emit light when exposed to ionizing radiation. TLDs are calibrated to measure the absorbed dose of radiation received by individuals during diagnostic procedures. They are worn on the body or placed near sensitive areas to monitor radiation levels accurately. TLDs are crucial for ensuring radiation safety in medical imaging and radiation therapy. Thank you so much for watching. If you appreciate this video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for more such videos.